Mental health basically, refers to the ability for an individual to cope with the normal stresses of life, and of course, to live a productive life. There are so many things that comes into place when we are actually talking about mental health. Society sometimes believes that everything that has to do with mental health is rather mental illness. They forget that there is a part called mental health. So the ability for an individual to cope with the normal stresses of life, know your limitation in life, and to live a productive life is what we call mental health. A lot of people believe that mental illness is attributed to spiritual causes, and with that it makes we the practitioners that are on the field sometimes go through a lot of processes before we can even win the heart of people to understand that mental illness also has a scientific base. Now, one of the causes of mental illness is what we call a genetic predisposition. In families, when you happens to have someone who had ever suffered mental illness before, what it means is that the whole family becomes vulnerable. It doesn't mean that the family, they all have mental illness, but what it means is that they have become susceptible, to the sense that if precipitating factors that has to do with the environment becomes uncomfortable for the person, it can easily predispose the person to actually suffer mental illness. There are so many stresses all over. Stresses where if individuals are not able to cope, it can predispose them to suffer any emotional disturbance or any psychological issues, which boils down to actually, suffer mental illness. We say that a healthy mind is a healthy body. So, of course, because we deal with emotions in life, diabetes is a physical condition. Now, when an individual suffers diabetes, and not just only diabetes, a whole lot of medical conditions, if not properly cared, can predispose an individual to suffer mental illness. Talk of typhoid, talk of HIV, talk of hepatitis, talk of any disease at all. Because whenever there is a change in your emotions, whether emotions or psychological states of mind, you should know that that thing has the tendency to cause mental illness. When an individual goes through the stress of diabetes, you know that diabetes becomes a stressor. If it is not well taken care of, and depending on the coping strategies of the individual suffering the condition, if he hasn't built that resilience where he knows how to go through the journey of going through such condition, you should know that his emotions becomes at stake. Stigma has become a killer disease now because a lot of people are hiding. A lot of people are not doing well because of the stigma. And one thing that we have to also take note is that mental illness has no respecter of persons. Today is somebody, but it could be you too, because mental illness is not really designed for a particular class of people. Neither is it designed for a particular, generation. It is a disease that has come to live with us. And with that, if someone becomes a victim of mental illness, we shouldn't stigmatize. We should rather help the person with primary support, where we can provide a person with the necessary support that we can help. Sometimes, not as necessary resources, but rather even the words that we use on people who are victims of mental illness is very